computer. Ooh, sounds like success. Okay, so we have today a MultiCare Samaritan Health Services affiliation, which we're here for IHN-CCO business, and this will definitely be impacting IHN-CCO. So I'm going to go ahead and hand this over to Bruce to get us started.
Thank you very much, Rebecca. Again, Bruce Butler, CEO of IHN. And those of us who are involved in the management of IHN are extremely excited about the potential affiliation that's working through the OHA review process between our parent organization, Samaritan Health Services, and the MultiCare health system from Washington. We believe that this affiliation has tremendous potential to enhance the healthcare resources that IHN members depend on in our community. Rather than just kind of having you hear about our excitement secondhand, though we thought that it would be even better if you could hear directly from representatives of Samaritan leadership and MultiCare leadership, and have them discuss their emerging vision on the future for healthcare delivery in our community. So with that, I will turn things over to Marty Cahill, who serves not only as the CEO of Samaritan Health Services, but is also the chairman of the board of IHN. So Marty, the floor is yours.
Thanks, Bruce. I appreciate it. And good morning again to everyone. We appreciate you being here. As you may recall, last fall we shared that the Samaritan was exploring an affiliation with MultiCare. Today, we come to you and talk to you today. It's really about two things: sharing where we are, where things are, and just as important, we want to hear from you. Any questions, comments that you have, we would love to hear them. Your perspective matters, not only to us, MultiCare and Samaritan, but to the state as they review this. You've heard the introductions. There's a number of folks from Samaritan and MultiCare on the call. But more specifically, you'll be hearing from Brent Godick, our Chief Population Officer, and then Melanie Matthews, the CEO of PSW and President of MultiCare Connect. So they're going to talk to you about where we are on affiliation. With that, I'll turn it over to Dr. Godick to walk you through what this means for you. Thank you.
Thanks, Marty. And thanks for everyone for giving us the time this morning. We really appreciate it. I see many familiar faces in the crowd. Some of you may know me, some of you may not. I'm Brent Godick, as they've said. I'm a family physician by training. And Linn County is near and dear to my heart because I came to Samaritan 16 years ago to practice at Geary Street Family Medicine in Albany. Still practice there a day a week, so keeping my hand in the game. During the 16 years with Samaritan, I've been a primary care provider. I've been in primary care leadership, medical specialty leadership, as the chief medical officer of IHN for about 3 years, and took all of that experience and leading our population health initiatives throughout the organization. And so, this is a really exciting opportunity to be able to come and share that potential that Bruce alluded to for things in the future. Before we get into some of that potential, I think we want to reiterate kind of what's maybe most important are the things that aren't going to change. And what the impact of this partnership with MultiCare, what that's going to mean for you all, our communities. We want to be very sensitive to the impact of the communities and minimize any disruption. So as we look at it, I think it's important to just emphasize that we're not going to see any change in the Medicaid benefit as it exists currently with IHN-CCO. There's going to be no coverage changes. There's going to be the same clinicians, the same benefits, the same CCO health plan with same ID cards. So there's not going to be any of that disruption. And I think that's important as we look at it. This partnership is really going to augment all of the good things that are happening right now. Going to the next slide. I think, as we look about this partnership is really about the potential that Bruce alluded to and kind of the strengthening of the opportunity that exists. In looking at the CCO model, when it was developed back in 2012 and implemented, there were some very intentional decisions made to create the Medicaid delivery system in Oregon differently than it's done everywhere else throughout the nation. And that is to deliver Medicaid locally and regionally, to create the CCOs that manage all of the Medicaid population within a region. And what this does is it really strongly incentivizes and encourages those partnerships that we have developed with all of you all within Linn County and all of our community partners. We have strong relationships with our community-based organizations, with Linn County Health Department, with the FQHCs in our region, to be able to make those investments locally, to be able to kind of pay it forward for the ongoing care of Medicaid. And we plan on maintaining that as well. And in all of the conversations with MultiCare, we're going to be leveraging those local partnerships to kind of use it as a springboard for what we can do in the future. So care will be kept local and it'll be strong. I think the models that we'll talk about today are going to be models that will help to create favorable practice environments to be able to bring in more primary care and more behavioral health clinicians to the communities to be able to provide the care that our communities need and deserve, and to keep IHN-CCO as a strong presence in our communities for the foreseeable future. So just wanted to reiterate kind of some of the things that won't change and kind of some of the strengths that we're leveraging here. I'm going to turn it over to Melanie now, and she could give us a good understanding and background on who MultiCare and PSW are.
Great. Thank you so much, Dr. Gaddick. I really appreciate the opportunity to be here. As indicated, I'm Melanie Matthews. I serve a couple of roles in the MultiCare organization, and first I'll do a little brief introduction of myself. I've been in healthcare for 30 years, hard to believe. I started in medical-related social service and really a strong passion and commitment to coordinating care for individuals, including the social determinants of health model and wrapping that within the medical model. And so very committed to population-based care and find that work and passion squarely aligns with the work that you're doing in Linn County and could be further advanced by this partnership. So I'm going to tell you a little bit about MultiCare. MultiCare, this is the 4 pillars that our board believes to be true. This is what we aspire to be, and this is the commitment to the elements that we need to be successful in the communities we serve. Number 1 is that we have a moral obligation to deliver high quality care to our communities that we serve. That is the first pillar that we think about and aligns with the work that we do. Number 2 is we strongly believe that healthcare is local, and we believe that it needs to be governed and managed locally, and really would adopt that concept in the Samaritan partnership and relationship. Thirdly, is we have a lot of assets, but the most important one is the trust of the communities. And we do what we have to do, whatever we can to preserve that trust in the decisions that we make. And we really feel that strongly that our cultural transformation allows us to be both patient, customer, member, whatever the definition is of the community member that we're serving, that we're very community centric and that we keep the members in mind in all the decisions that we make. So those are sort of the foundation of our pillars of what we aspire to do and the way that we think about how we deliver and administer care and partner in the communities we serve. Next slide. So this slide sort of says, okay, so how do we do that? What is our strategic framework? And I think it's really important to recognize the values that MultiCare has as our organization throughout. 1 is respect, 2 is integrity, 3 is stewardship, fourth is excellence, collaboration, kindness, and our most recent value we adopted is joy. And the more joyful we are, the more that will resonate within the communities that we serve and work within the dynamics in our markets. Our mission is to have partnering for healing and a healthy future. And the key word in this mission statement is partnering. And I have some examples that I'll be able to share on how we partner with communities. And our vision is that we will be the Pacific Northwest's highest value system of health. And we consider Oregon right smack in the middle of the Pacific Northwest. And we already provide some services on the population health side in the state of Oregon. So we have 3 strategies. Our organization wraps our work around 3 different strategies. One is expanding access to care and services. And this is how this is defined by the communities. So this is really driven by what the community feels that they need. So for example, access to more primary care. Or Dr. Godek and I have spent some time talking about the wraparound services in the care model to help support primary care physicians for the work that they do. Number 2 is performance excellence. This means that we need to deliver high quality at a low cost. And that's our mission. And thirdly, which I'm going to spend a little more time talking about, is our population-based care. That's where we want to innovate access. We want to transform care delivery. We want to have patient engagement with what they need, meet patients where they are. And part of that is redesigning the business model, which is really what the CCO is about doing, is really having the financial model of for Medicaid be aligned with the community partners and systems and public health and et cetera. So I wanted to share, next slide, a little bit about PSW. So what is PSW? PSW was founded 31 years ago last week. It was formed by independent primary care and specialty practices in Thurston County, Washington. And the intention around why it was formed was there was a lot of consolidation, and the independent providers wanted to maintain autonomy at practicing at an independent physician level. And they formed together to allow an entity to help them manage risk, payer contracting, and provide wraparound services that PSW could help support to take care of the patients that they serve. And this is really the basis for a population health company. We've been 30 years in the making of how to manage and help support communities. And so MultiCare, in 2018, they were on a journey to do population-based care and said, how about we partner and invest with PSW? And PSW said, we'd like to partner and have a broader opportunity to support communities. And so we forged a partnership in 2018. So MultiCare is now a majority owner, and we're still owned by independent physicians as well. And collectively, our population health platform at PSW supports about 450,000 lives in all types of payers: Medicaid, Medicare, Medicare Advantage, commercial. And we apply our platform of support services to both large integrated health systems, community health providers, independent physicians, critical access in rural communities. So we apply our resources and support structure to various types of organizations, big and small. And we love rural and smaller communities because it's so connected. People know each other. And so we really appreciate working in those communities where there's a strong foundation and relationships. So our real sort of mission is to accelerate transformation of healthcare from volume to value-based care by innovating and collaborating to achieve the outcomes that the communities desire. And I think it's really important to recognize that this is a population-based care is, I always say, it's a dimmer switch and not a light switch. It's making investments into the way that we support communities. And one of the things that we hold extraordinarily true is that these values are what center our work every day, all day. And the first one is egoless action. We are there to support communities where they are, and to do that in a way that puts egos aside for the broader good. We find it incredibly important that advocate for innovation as healthcare policies are changing all the time at both the state and federal level, and to ensure that we're advocating on the behalf of the perspective of the patient and the provider and the communities. Healthcare with humanity, all day, every day. True compass heading us our direction every day. And we feel that we are generally better together when we work. So we specialize in how to partner with various community-based organizations, providers, patients, etc. And just generally do good and be good. So those are the sort of tenets that we hold true every day. I've been the CEO there for 10 years. It's been a tremendous privilege and honor. And really, when I think back to my social service director days, coordinating patients' discharge planning, this work really resonates with me, that we have a fragmented health system and that we're all on this call working hard at helping to ensure that we have shepherds of care that can help navigate and identify and close gaps and help patients coordinate a really complex healthcare system. And we feel true that the PSW and the population health principles and how we would partner with Samaritan would help enhance and wrap those services around in the community and support, and really just augment and build upon what's already working. So I just wanted to share that was sort of our philosophy, framework, and mission vision for PSW. A little bit more detail about MultiCare as a nonprofit health system in Washington. We are the largest Medicaid provider in the state. And really, we are also the largest provider of urgent care and have invested greatly over the last decade in becoming the largest behavioral health. We feel that behavioral health is an integral part of taking care of whole person patient care. And so we've made those investments into the behavioral health. And then PSW serves as the population health partner for MultiCare and all the types of other organizations that I just described. And our real focus is improving access, quality, and healthcare outcomes over time. Go to the next slide. So I really wanted to share that really healthcare in here stays local as it relates to this relationship. Our care teams and staff will continue to support the work that's being done. I have a slide that shares a little bit of what we will bring as what we believe to be a value addition to the structures that are already in place. Local leaders will continue to guide care and services, and we do not expect any staffing reductions, and that care would still be provided by the local care teams. And the community advisory committees will continue to play a strong role in that work. And this partnership would aim to just strengthen the services. Next slide. See here.
So I think I think this is I start this one off, right? We're here to I think just lay it out where we are today, right? We need to be real honest and transparent, and I'm not here to sugarcoat things either. There's definitely opportunity for improvement. We know that access to care is challenging right now. It's not just a local phenomenon. It is a phenomenon that is going on nationally, but it impacts us in our communities right now, that primary care and behavioral health access are challenging. We're a smaller system in the relative scheme of things, and I think that provides some challenges for us to be able to be as nimble as we need to be in the ever increasingly dynamic healthcare market that's kind of present in the nation right now. I think that's part of where the partnership provides that opportunity. And historically, our performance as a CCO on the quality incentive measures that are put forth by OHA have a lot of room for improvement. We're building out the infrastructure for that. Historically, we've been a bottom quartile performer compared to other CCOs throughout the state. I think we're starting to see some shifts of change of some preliminary data for our performance in 25 is showing significant signs of improvement. But we need to be able to hard code that care delivery into our system. And I think that that's really what this partnership creates, that we can start to build that infrastructure to be able to improve the care that's going to be delivered. And I think Melanie now has an opportunity to be able to show kind of some of those things that PSW can provide for us that are going to help in these areas.
Thank you, Dr. Gaddick. So I wanted to share that one of the ways in which we can provide services and support is our NCQA accredited population health program. So the National Committee for Quality Assurance has a certification for population health, including social determinants of health. And what it really does is it evaluates the empirical evidence, best practices, and both how we engage patients with motivational interviewing and how we develop a plan of care to help patients and members be successful in achieving their healthcare goals. And so we have put a lot of effort into the workflows and processes. We have physicians, nurses, care navigators, and social workers that utilize that NCQA accredited programs in order for us to engage patients and really develop the right plan of care for them. We also have the resources to support primary care. So back to my social service director days, I will share with you that there was a lot of social needs that impacted the healthcare outcomes for patients and situations, and that engaging in those efforts to help navigate social determinants of health were really successful, both in helping provide support to physicians who are burdened and really need to focus on diagnosis and treatment on the medical side, is that we could provide additional resources to help support primary care, which helps the patient and helps the provider by having those enhanced care teams. So there's a lot of focus around that. And then the local deployment. Again, healthcare is local. And so the community-based organizations that are in place, those would be highly utilized in partnership to help achieve those goals. And then lastly is data really matters. I think one of the things around how we help support patients and members is that we need to identify the high and rising risk patients that may need additional support before they need it, and then ensure that we're helping manage chronic conditions for patients that need a lot more support in the healthcare system. So we utilize a lot of data to help identify where the best needs, where the most needs are, and how we can best provide services to those patients. And so a lot of what we've been talking about is what kind of data systems and tools that we can help provide to augment and support the work that's already underway. And then I'm just going to finish up here by saying that patients and members' stories really matter. And every day and every meeting, we spend a lot of time engaging with our case managers and social workers and nurses in ways in which they're making a difference every day. In fact, yesterday the staff meeting was communicating some patient stories, and it's really how we identify and really connect that the work we're doing is meaningful at a very patient level. And so as our social worker is really doing follow-up calls from a patient that was in the emergency department, before they do that call, they're really reviewing the chart, and they're looking to make sure that the care that was described that should be done after the emergency visit actually happened. A lot of times, there's a big plan and discharge orders, and then the patient leaves, and everything that was supposed to get done did not get done. Like the home health never showed up, the toilet riser didn't get put on the bathroom, any number of things that can occur. And one of the things that's most important to success at avoiding readmissions and ensuring that the patient is getting the right services in the community is that they have their primary care follow-up appointment. And that can be an area where it gets missed. And so I just wanted to illustrate that our social worker, when they call the patients and manage the discharge and work through the chart, then they engage with the physician practice to ensure that those appointments are scheduled and transportation is arranged, because maybe they have the appointment, but they don't have transportation. And so that's the kind of work here. And I just wanted to describe that that's what we do, is we identify gaps and then we help close those gaps. And so I just wanted to conclude my portion of this discussion today, bringing it back to the patient. And then the last thing I wanted to share with you is that MultiCare has a Center for Health Equity and Wellness. And that's about how the system works to ensure that we're keeping equity and belongingness into the policies and procedures that we create, and that we're educating our staff to those intentions, and that we have interpreter services, but really how it connects with Linn County and really this partnership is that we take into consideration highly the community needs assessment at a local level so that we can prioritize our population health priorities and initiatives based on what the community needs. So for example, in another market, we have a community where they have a high mortality rate, maternal mortality rate among the Hispanic population. So we have a specific initiative to help target increasing better outcomes for that population based on the community needs assessment. So I just wanted to share that, in every community that work is underway, and that this work would coordinate with the existing work and priorities so that it could fit squarely under the initiatives that the communities. And then I know these slides will be sent out to you, but I have some information here on the community impact goals for wellness and health promotion resources and preventative work. And again, using data to help identify that. So I just wanted to share a little bit of information on that.
Thanks, Melanie. I always get so excited when I hear when she presents about PSW and all of the different opportunities that really they create. And I think this is really going to help out you as our community members, our IHN members as well, but also our care teams. And I think that this is where all of these support services are going to help us recruit significant primary care talent to our region, because this is a care model that clinicians are going to want to practice in. Speaking as a PCP, I think historically there's been a growing awareness over the past 1 or 2 decades of the impact on health outcomes of all of those social determinants of health. And historically, the resources to address those social determinants of health have been layered on top of the traditional care delivery system. And we aren't getting the optimal outcomes. And what I really like about a population health approach like Melanie's proposing is that you have experts that their job and goal and focus is addressing those social determinants of health. That works in strong collaboration with the clinical teams to allow each to sort of be most effective in what they do. And personally, that's what I'm continuing to practice primary care, because I look forward to be able to practice in that type of environment. And I think that that's going to help us bring more primary care and behavioral health providers to our region. Melanie spoke about the importance of data. We do a pretty good job taking care of the patients that come into us. We don't do a great job of identifying those patients who should be coming into us. And I think that that's where we can leverage the data to say, who aren't we reaching? Who aren't, through our traditional care delivery, who is falling through the gaps in our fragmented system? I love the patient example. It really kind of talks about all of the opportunities for people to fall through the cracks, particularly in those transitions of care. It's some of the most vulnerable times within patients' and members' healthcare journeys. And when we can provide those wraparound services, we can help shepherd people through our current system. And I think one thing that Melanie spoke of that really excites me, and I don't want it to be lost on us, is that NCQA accreditation that they've accomplished. That establishes PSW among the elite, right? The criteria to reach that NCQA accreditation is a very high bar for kind of the exceptional standard of care. And so, that's who we're looking to partner with. And those are the resources that we're looking to bring to the communities. And so, I think that it just establishes us as PSW as kind of very high functioning and effective care delivery systems. And when we do this, it's going to improve the health outcomes of all of our communities. So if we go to the next slide, just to reiterate, right, this partnership over time is going to improve access to care. Care is best delivered when it's local, and we want to make sure that we bring as many services as we can to our communities so that patients, members can be treated as close to home as possible. And we've developed strong relationships with you all and all of our community-based organizations since the inception of the CCOs. We want to be here as a strong health plan for the foreseeable future. And so I think this partnership, as we spoke to earlier, allows that to continue. And this is a long-term commitment. This isn't just going to be something that we boost things up for a couple of years and then walk away. We're invested in the long-term evolution of our communities. So if we go to the next slide. Okay, so we've heard about the partnership. We've heard about all the great things that MultiCare and PSW can do. So where are we now in this whole process? So Oregon and OHA are in the middle of the review process where we've submitted our application for this partnership and the affiliation. And OHA, and there's several different components of that, are looking at all of the different components. One is the system, one is the plans, and then we're also looking at the Medicaid component in particular. And they're going to be evaluating, does this partnership make sense? Does it make sense for the members of our community? And the kind of the lens that they're looking at, is this going to improve access to care? Is this going to improve the quality of care that's delivered? Is this going to help break down further barriers of health inequity? And is it going to be financially stable for now and the foreseeable future? And from the Medicaid Advisory Committee, they're going to be looking, and they are looking for community input to be able to weigh in to see what our communities feel and think about this. And I think you all as Community Advisory Committee members have a very unique perspective to be able to kind of see and understand what the impact of this partnership might have locally. If we go to the next slide. And so your voice matters a lot. And I want to emphasize that. And I really value community partnership and input. There's a saying that's in healthcare that it's nothing for us without us. And so I really value your input and your perspectives in what we do in the care delivery. And so there are formal opportunities for you to lend your voice to OHA as they consider their decision making. We come to you today to let you know that the Medicaid Advisory Committee, the MAC, is meeting on April 29th. There's an opportunity to provide oral or written testimony during that meeting. We'll make sure that these links are get out there with the live links in there so that you can click on there to pre-register for that meeting. And there's also opportunities to be able to provide email comments or even leave a voicemail. So a lot of different ways that you can provide your feedback and your thoughts on this. But additionally, we want to hear from you today. We're here, want to be able to answer any questions that might have come up during our presentation or things that you've been thinking about as you've been considering the affiliation as it became announced. Certainly open up the floor for questions, any concerns that you have, but I definitely want to hear what matters most to you for our communities.
Okay, thank you. Before we go to questions, I do want to welcome three people who had joined a little bit after introductions. Judy, thank you for persevering. If you wanted to introduce yourself, you could.
I'm just laughing. I kept sitting here saying, what is wrong? What is wrong? Anyway, I'm Judy Rinkin, and sun's shining, and it's a wonderful day. Thank you all, and this presentation was good. Brought back old memories. Thank you.
Thank you, Judy, and thank you for always advocating for the children and youths. George. We have George Matland on the phone, and he is an advocate for housing and houselessness, and I think behavioral health as well. So he's here. And then I would like to welcome Tyler, if you could introduce yourself.
Good morning, Tyler Jacobson. I'm Chief Legal Officer for Samaritan Health Services.
Thank you. Okay. Questions, comments?
I have a comment.
Jan?
Yes. Um, it's interesting that everything that they've just spoken about, I had some experiences in the past week with several of those. So being 72 years old, being disabled, etc., has a lot to do with that. But also the fact that I'm educated, so I was able to get through the obstacles. It took a lot of phone calls to do it. I was trying to get a new primary care physician because I was told day before yesterday that my primary care physician was no longer my primary care physician. And I was going, well, why would that be? And the woman couldn't really explain to me why that was. So I called InterCommunity Health Plan, OHP, and the man, Grayson, was extremely helpful. He went through the obstacles with ease and solved all of the problems I was having and helped me to find another primary care, etc. So it was wonderful.
Thank you, Jan. I thought we might have a big problem on our hands, but it sounds like you had a really positive experience. So thank you for sharing that. Comments, concerns, and compliments are also welcome. Any other questions, comments, concerns? Catherine?
Yes, hello, and thank you for that presentation. So your presentation was awesome. It was, slick. We addressed all the areas that certainly we have concerns about, but, and I would expect nothing less than that. But my question really is about, so what does a transition look like? Where are people going to be, where are providers going to be impacted, or what's going to change? I've heard there's anxiety out there in um, the people who are actually delivering the services. Not that I've surveyed everybody, but I have, friends who are working within the system, and just want to have a sense of what does this really look like? And I'm very excited about if we can really live up to and support the standards that you've laid out for us, then we're going to be flying high over the next years. It's just getting from here to there that my questions are about.
It's a great question. And I have to say, I would love for it to be tomorrow. It's not going to be. And I think we have to wait, I think for the formal process to occur for
Right.
Oregon to start to kind of give us the green light to be able to go and start to build these things. We're having some conversations now on what that could look like, so we can start to ramp up on our side to be able to kind of meet at the rally point, as I'm saying, to be able to kind of proceed forward. And it'll be iterative, right? I think that, like Melanie said, it's a dimmer switch. It's not a light switch. So it's not something that's going to be, oh, the next day the clouds are going to part, the sunshine's going to, kind of rain through, and things are going to be better the next day. But what I'm hoping that we will all feel from the care delivery, from the community side, is that we'll continue to progress and advance as we continue to evolve and grow together. Right. And that we'll be making iterative changes that'll just be positive as we move forward.
One last comment is this is always a concern of mine, or I always feel how important it is in the transition, how you help the people that are going to be having to make changes, how you help support them along the way. And I think if it really will impact the success and decrease the resistance to whatever we experience. So just want to support you, and I know you already think about all those things, and just want to put in another underscore there.
I appreciate that. Marty, thoughts on communication? I mean, I think communication is going to be a key part of this, but Marty has been
Yeah, we're rolling this out again. These presentations, opportunity to talk with the community is going to be very important. I think, and I hope that really, as this affiliation closes and we start moving forward here with PSW, I hope it's seamless. I hope that our patients don't really recognize at all the change. What I hope that they'll see is that we'll be looking at the data now, driving data driven decisions. We want to look at the best practices, take a look at all the resources that PSW can bring to the community. And I hope that those are all additive to the care that people are receiving today, and that all that folks are seeing is that there's not going to be changing your card, not a change in any of those types of things. We just hope that over time we'll be able to create greater access. We'll be able to hire more primary care clinicians to take care of you, and then make some really good data-driven decisions around quality and how we take care of the patients. And as Melanie talked about, they're the largest Medicaid provider in the state of Washington, moving to be the largest behavioral health provider in the state as well. So there's a lot of learning opportunities there for us here at Samaritan to take advantage of for our patients. And as Dr. Godek said, it probably won't happen day one. It's not gonna, but we like to see that over a short period of time and into the future, we're really developing those lines of communication with PSW and with our patients to take care of them in a better way. Thanks.
Great question and discussion. Before we go to Todd, we have a question in the chat, and it's Leah's asking if there are interruptions in care currently. And Leah, I want to say we can talk about the specific interruption later in the meeting during that part of the agenda if we don't address it here. But the question is this affiliation process going to be impacting, or is it impacting IHN-CCO benefits?
Yeah. So as I mentioned earlier, the benefit package will not be changing at all. That's still going to be the standard Medicaid coverage as it currently is. So this partnership and affiliation will have no impact on that. Sorry to hear, Lee, that you're struggling with that kind of care transition. I think that in my mind, this is what population health does, right? Melanie mentioned it. I wish it wasn't true, but we have a fragmented healthcare system where there are gaps between different points along the care continuum. And sometimes people get stuck in those gaps. And the job and the focus of population health is to help people navigate through those gaps in care. So that if for some reason, it's a matter of getting you to the right eye care that you need, right? And where unfortunately, there are times when clinicians leave our communities. Well, how do we get you to another clinician? Because we have the capacity within the network of clinicians, but how do we get you to the right clinician? And that's where population health can happen. So I'd love the feedback, and I think we can probably connect with some health plans folks to make sure that we can get you to the right care, but that will be more seamless in the future once we can get more embedded population health resources to help navigate that.
Thank you. Great question. Todd.
Yeah, so this is a comment. It's for the members of the committee and also for MultiCare on the call. I just wanted to, and I know I've told the members this before, but IHN has really done a solid for the safety net, especially in highlighting this last year. Many of the CCOs across the state, they opened up their networks and they ended up having a lot of therapists from a behavioral health perspective, therapists online in different states, open their networks wide. And what happened is that the people that really needed the treatment in a major substantial way, folks with severe and persistent mental illnesses, safety net services, crisis services, it really decimated the behavioral health network in around the state. And most of the CCOs with this last year, they actually have cut community mental health programs. And again, we are the boots on the ground. And I take my hat off to IHN because IHN did not do that. IHN has always been local. IHN has always focused on the most needy folks, the folks that really need the treatment, the most vulnerable. And, it's sort of decimated in many ways, our workforce, people making great money, sitting at home on their garage on a computer, seeing people, 200-300 times for adjustment disorders, while we couldn't hire people that really needed the treatment. And IHN has invested. And I know I've talked about this before, but right now, and this is for MultiCare to know, um, in our association, which is AOCMHP, every single director says they literally take their hat off to IHN and how they're literally invested in the people that need the treatment the most. I hear it every single. I'm going to be on a call here shortly, and I hear it constantly. And they're like, "Wow, it's amazing," because lots of other ones they've done cuts, some substantial cuts, and it's very problematic especially now we have a new CFAA as far as what we have to focus on. And IHN has really stepped up. And so I know that the health plan was one of the things that MultiCare was looking at. And I think you picked the right one. And so we're the mental health authority here, public health authority. And so as a partner that had a great relationship for many, many years, we're very excited here about this merger, about this, because I think it's just going to increase access to care. And I really take my hat off to IHN.
Thanks, Todd. Do we have any more questions?
Rebecca, maybe I'll just say one thing. I just really want to again emphasize, and you address this in your presentation, but we're just so lucky, so fortunate in our community to have strong community partners who really make the difference between supporting their clients to be able to interface with the services. And just really, and of course, our committee here, working in the way that we do, just really want to support. And I know that Benton County and Lincoln County also have strong networks, but Linn County, we couldn't do this at all without the base that we have. And just to put a plug in, I know Jeannie's on the call, but how important our medical school is here and how the potential resource for more educational opportunities and transition into being actually local practitioners, just as really provides us an opportunity to take advantage of that.
Thanks, Catherine. Bruce.
Yeah, thanks. I would just like to express gratitude to Melanie and Brent and Marty for taking their time for a really great presentation. And I just hope that that all of you have a better sense now of why we at IHN are feeling so good about this development and the great potential, of combining the kind of resources that this affiliation is going to bring to the table, with the history of community partnership that Todd just shared with us. And Todd, thank you so much, as always, for your support.
Thank you.
Rebecca.
Yes, George.
Dr. Godek, in your communication with this new affiliation, what is their viewpoint on homelessness as far as services to the homeless?
I mean, I think they're committed to our communities and the needs of our communities and of our members. I think, Melanie, do you want to weigh in on that? I think we have the opportunity. I believe that they're committed to that, but let's hear what Melanie has to say as well.
Yeah, I thank you for the question. As you know, we're waiting for the affiliation process to go through, so we've been fairly preliminary and kind of detail in the community level. And today we've just sort of been focusing on the concepts, and Catherine, some of the questions you had around change management and communication management. But in terms of addressing the specific needs, those are very much real issues for the communities that we serve. And we have a lot of work coordinating with that, particularly in the Center for Health Equity and Wellness. And so as part of our implementation priorities, we would identify that as one of the key areas that we would focus on post-affiliation.
Thanks, George. Did that answer your question?
Yes.
Right. Any other questions or comments? I don't
Yeah,
want to
one
go.
more.
Yes, please, George.
And I know I'm not trying to be the pessimist of this group, and I've been out for quite a while, and I apologize. But Dr. Godek, at any point do you see the Linn local or CAC's hands being tied up in any way, shape, or form with the process that's going on now?
No, not at all, George. And I appreciate that question. The voice of the communities is paramount to the future of population health and the success of whatever healthcare delivery we need to do for our communities. We need your voices. I could sit behind my computer screen or my desk and try to come up with solutions, but I know I'm going to miss the point because I don't have that valuable voice. So it's a really, really important perspective that we need to be able to continue to tap into. So I don't see any restrictions or any negative impact at all, George, to the community advisory committees in the future.
Good, good. Thank you.
You're welcome.
I have a question.
Yes, please, Jan.
Yeah, do you perceive that we're going to get more primary care physicians in the state of Oregon? Because it seems like there are very few, and to get an appointment, it's 6 months out for me to see the primary care physician. So it's like, okay, well, 6 months is a long time at my age, especially. So do you foresee that we're going to have more, hopefully, in the state of Oregon, that we have, that we're able to get appointments with sooner than 5 or 6 months?
Yes, Jan. We need to. We need that. We know that primary care is preventive care. We know that the more primary care we can provide, that improves the health outcomes for all members of our communities. And we know that we are in need of primary care providers as well right now. And I think if we can show to primary care providers when we recruit the strong support models that we can provide, then I think that that's going to really entice people to come to our communities. I love practicing in Albany. I love practicing in our region. I think we can share that with other primary care clinicians, internal medicine clinicians, family physicians, to be able to get them to be able to show that we've got a supportive model that we can really drive positive outcomes for our community members. So yes, Jan, we know we need to, and I believe we'll be successful with that in the future.
Wonderful, thank you.
Melanie, can I maybe ask you to, as the CEO of PSW, I think that's part of the work that you do, am I right, is around retention and recruitment?
We do the more of the focus around providing services that wrap around the primary care that allows them to take more patients because they have more resources to address the non-medical needs that take up a lot of time. And so that's one of the components that Dr. Gok and I have spoken about. But, kind of share the care model, which allows the ability for primary care to take more patients that they care for because they have more services to wrap around them. So that's the strategy that we would entail. And Dr. Godek mentioned it, but I just want to double down that primary care shortage is a national issue. And And it's really in every market we're hearing it. And there's a lot of reasons for it. And, not that we necessarily have time to go through all of them today, but there are a lot of them for why. But one of the strategies is to provide more services to support the primary care as a way of increasing access.
Yeah, great. There's different strategies to get to that, to making sure that people do get those appointments more quickly as they are needed. Thank you. Emma.
I'm curious when we're talking about like more wraparound services and support, will some of that look like having traditional healthcare workers or peer supports to be able to support clients alongside care physicians?
From my perspective, post-affiliation, there'll be more specific evaluations around what community health partners and services that are available to partner with. Some of those can be support services with community-based organizations. But the services at PSW under the NCQA model is really focused around the community health worker model, as well as nursing support and social worker support. And, one of the things is healthcare is local. So where the community has services already in place, we would just look to augment them with either our workflows that are NCQA certified, using the data to help identify who to outreach. But we would not look to replace the great work that's going on, but where can we supplement it? And that's part of the process that will be underway post-affiliation. So we've kind of talked about the framework for it, and we have the ideas. And, we want to hear from the CAC members so that we're making sure that we're thinking about it and prioritizing it appropriately based on what the community needs. It's not what we know. We have systems and tools we can help support, but it's what and what the community knows that can help us, and how we would identify and prioritize that work so that we don't duplicate anything. And also, I just want to share that, in kind of the providing a little bit of overview of what PSW has done, is we do a ton of partnering, and one of them is listening and understanding the community to make sure that we're putting the steps in place and prioritizing that in a way that makes most sense. And so sort of when Catherine brought that up, it's that change management and how do you communicate, and making sure that it's very aligned is absolutely mission critical to how we best partner in a community. And we have a lot of experience in that space because we support a lot of different communities.
Thank you.
You are welcome. I hope that answered your question.
Any other questions? So I have one question. I have gotten to hear this presentation once before. We're going around to the local committees, and I've gotten a chance to really get excited about the resources and the things that MultiCare can bring to this affiliation. What I'm wondering about is, what does MultiCare see specifically about IHN-CCO that they bring to the MultiCare affiliation?
I can speak that I think that there's going to be great opportunities, the synergy of what Bruce and team and Samaritan has put into place with Dr. Godek, that will be a value add to our bench strength too for managing populations and engaging. So one of the things that we have planned post-affiliation is really the review of all of the capabilities. And sometimes we all have to take a nice hard look in the mirror around where our opportunities could be enhanced by doing it differently. And so I think that we're going to be very open to that as well, and excited to work with the leadership and teams, and then of course the community, as we just discussed, for prioritizing to see where it could be a win-win. We're very big into win-win-win, and nobody themselves knows everything, but collectively we can always learn more from hearing what's worked well. And so we really have that kind of questioning mindset and desire to learn from everyone across and different subject matter expertise. And so that is certainly true. We learn from the partners, and partners learn from us. And so that makes a beautiful partnership, and we can work that out.
Great. Any other questions and comments before we close out the presentation?
I wanted to say thank you for the opportunity to talk about population-based care. Super passionate about it. Super excited to work with the leadership teams and the communities and have a positive impact. So I really appreciate the opportunity to share a little bit about our story today.
Yeah.
And if you think of any additional questions later, Rebecca certainly knows how to get a hold of me, as many of you on the phone do as well. So happy to answer any questions that you might think about when you hang up. So
Yeah. And I will be sending out to the group the presentation slides and the contact information. And so I want to hand it over to Marty to close out our presentation.
Yeah, thank you. Thank you, Rebecca, and Dick, committee. We really appreciate the opportunity to present to you today. Dr. Godek, Melanie, you guys did a great job. We covered a lot of information today. Very informative. Really appreciate the presentation. I hope the committee found it. It sounds like they did to be very informative. Maybe some thoughts as we close it out. I hope you heard that our focus is going to continue to keep care local. We want to continue to stabilize that care and make it stronger over time. Your voice as a local advisory committee is important in the process, and we're committed to making this a two-way conversation. Again, we appreciate the questions today. If you have any other thoughts afterward, Rebecca can get you the email address, but affiliation@samhealth.org would be a great place to drop in questions. And if you think of anything later, feel free to drop them in there. We appreciate your time. Again, we appreciate the opportunity to present this. And we would love to hear more from you. We definitely want to keep this a two-way conversation and ensure that you feel a part of the process as we move forward. And with that, I'll pause and thank you again for the opportunity. Thanks, Rebecca and Dick. We appreciate it.
Thank you.
Thank you, Marty.
And we will talk later in the meeting about how we might support this. So more to come.
Much
Thank you.
appreciated.
Have a great day.
Thank you, all of you.
Thank you very much.